Welcome to Frontline Nursing, a NurseMinder production that gives you an insider's look into the daily life of nursing from those who are currently working on the front lines. Whether you're considering nursing as a profession, you're already a student studying, or you're a nurse in transition towards a new patient population, this show will give you some behind-the-scenes information to help you guide your career. So get those note apps and pens and papers ready because today is going to be a good one. Today on Frontline Nursing, we are joined by Angelo Dalangin. He is an LPN who graduated in 2016 and is currently working in orthopedic rehabilitation nursing. He's also known as the singing nurse, so welcome to the show, Angelo.
Thank you.
I'm really happy to have somebody else with such a passion for music on the show.
Yes.
So let's get started. I always think it's fascinating to find out what brings people to the profession of nursing.
Okay, so it started when I was a kid. I just this sense of feeling that, when we were playing as kids, when my siblings got hurt from from playing, I want to help out, putting some bandage on and stuff. And then from that moment, I realized that I really want to pursue nursing. So when my family moved here back in 2012, I didn't pursue nursing right away. So before, I was taking X-ray technology back home, and then I didn't realize that when we moved here, I was able to pursue my childhood dream, which is nursing. So I'm really glad that I was able to do it. I was able to do it right now and then help people.
So you said you moved here in 2012, and where was
Yes.
that from?
From the Philippines, yeah.
From the Philippines.
Yeah.
And you had already started your studies in the
Yes,
Philippines.
I did, yeah.
Yeah. So when you came here, was it not a natural then to continue on in that process? I forget, was it X-ray?
X-ray technology.
Yeah.
Because back home there are lots of nurses already who graduated, but they kind of a bit of struggling, like finding a job, doing some volunteering and stuff. So I had to do a contingency plan if in case that happens. So I ended up taking X-ray technology. But when I go back here, um, I started to apply and stuff, but then I don't make it to the list for the X-ray technology. And then that's the realization that why don't I pursue my childhood dream, which is nursing, wherein, I would be able to do what I really want to do.
That's fabulous.
Yes.
You know what? That's where we met, actually, was at
Yeah.
Northwest College. And that was
Yes.
one of the things I absolutely loved about that school is that it was inclusive and that you didn't have to have certain grades or have a certain background. If you had a dream, you could become what you wanted to become. So
Yes, yeah, I
fantastic.
agree. Yeah.
I love it. So you find yourself now working in orthopedic rehabilitation nursing.
Yes.
And you've been there for a little while.
Yes. Like 2 years, 2.5.
2.5 years already. So you've got a good sense of what an orthopedic rehab nurse needs to know in order to be successful. Talk to us about some of the challenges you had when you first got into that field.
When I got into that field, there's this feeling of like a bit of a fear because you're new to the environment. But then somehow my coworkers, or because I spent my clinicals on that unit before in Capital Care Grandview, so somehow they're pretty welcoming to me. So somehow that fear or that hesitancy that I had, like asking questions, asking about this kind of skill to my preceptor back then on that time, or that turned out to be my coworker, it became a bit lighter because they're very accommodating. But it's somehow more of like leadership skills as well because I'm new to the unit. Like just like what I said, I'm the youngest one in the unit, so somehow that hierarchy wherein your coworkers are a bit older than you, that they've been working there for like 20 years, so they know the routines in the unit already. And me, I'm just trying to feel the sense of what's in the unit. So somehow I'm a bit hesitant to ask questions, but I realize that there's no harm in asking questions to your coworkers. It's not a sign of weakness or anything, but it's a sign that you're honest and you want to learn more.
Yeah, that's amazing. So did you go right into a leadership role there?
Somehow, because we have 2 charge nurses and then 3 licensed practical nurses and then the healthcare aide. So whenever our charge nurses are busy, when somebody had a fall, when a patient had a fall, then we have to take charge, especially at nighttime. And sometimes we've been moved to other units, like we have the post-acute unit and then 3 long-term care units. So sometimes we are assigned to like long-term care, wherein, you know, if there's an outbreak, then we have to take over and then, yeah, go with
So
that.
you've mentioned geriatric population. Is this orthopedic rehabilitation unit focused on the geriatric population as well?
More of that, but we had a few patients that are like teenagers, but then mostly the geriatric population, around 50s to like 50s above. Yeah.
Okay, hold on a second. Do I look like a geriatric to you?
No, no, no. No.
Oh my goodness. We'll have to change that age bracket there, Angelo.
Okay, no worries.
This is what 50 looks like.
Yeah. Really, you don't look like 50, though.
Thank you, thank you.
Yes.
Well, now that we got that sorted out.
Yeah.
So for those
Yeah.
listening, the video footage is actually available. Okay, so let's get back to that geriatric population and your 50, your young crowd of 50s.
Yes.
What are some of the typical diagnoses that you deal with on your unit?
More of like hip fracture.
Okay.
Because lots of our patients are falling like from their houses, like during winter time, like on the roads. So mostly hip fractures.
Okay. And so these typically hip fractures, what I'm thinking about is they go to the hospital. If they're surgical, they get fixed up, they go home in a couple of days and they recover at home. This population, is it that because they don't have a home to go to, like they're already in a care facility that they come to you, or is it that they don't have supports in the community?
It's like they had the surgery from the hospital, and then it's like for us, it's a rehabilitation unit slash transition unit. We're in. They've been moved to us, and then they've been transferred to us, and then we prepare them to go home. Like they are there to do exercise, do stairs, like because they had hip fracture, to practice them how to get in and out of the bathroom, in and out of the car, practice stairs, so that when they get home, they'll be ready to do things that they do before.
Okay, so not everybody goes from an acute care facility home. Some go from an acute care facility to this transition unit for that extra
Yes.
support that they need, and then they go home,
Yes.
ideally.
Yes.
What's the typical length of stay for somebody in your unit?
Around 2 weeks. 2
Okay.
weeks, but then if it's like a multiple vehicular accident, then it could range up to a month or 2.
Okay, so
Yeah.
somewhat long-term stays, you get to know these people fairly well.
Yes.
You get to know their struggles, their fears, their hopes, their worries.
Yeah. Yes.
Yeah. In terms of, like the length of time that they stay with you, and we're focused on that movement and mobility, what are some of the most common barriers you're finding with the patients to get them where they need to go?
Um, Sometimes their level of cognition. We have a patients that are already demented, so sometimes it's hard that to communicate with them, or language barrier, like people from different countries that English is not their first language, or in just basic English, it's hard to communicate sometimes. But through the help of the families, as well as they give like um, translations like in a paper, when basic languages and stuff, will be able to overcome that. As well as sometimes our patients are like, before they are pretty independent, they want to do things on their own, and sometimes they don't want to listen. If you ask them to ring the call bell, and then we'll be helping them out, sometimes they're getting up by themselves, and then we're finding them like walking already, which is a bit it's a bit of
Stressful?
scary part for us. It's stressful as well, because we want to help them out, guide them as much as all we want to. But yeah.
Mm-hmm. Are there any, so when you mentioned the patient population that deals with dementia, is that a significant part of the people that you're dealing with?
Yes. Yes. Half
Okay.
of them, I guess. Yeah.
Okay. Just because you'd mentioned the geriatric connection, I was wondering
Yes.
for your unit in particular. So when they're being rehabbed, they're likely going back to a long-term care home, and they need to be able to be stable enough to go back.
Yeah, some of them, yeah, they go from our unit, they've been transferred to long-term care facilities.
Mm-hmm.
Yes.
Mm-hmm. In terms of like I'm wondering, so we have, I guess, I'm thinking of the surgery. So we have this hip, right or left,
Mhm.
typically is. Do you
Yes.
guys just focus on hips, or do you get any other joints?
Hip fractures as well. Sometimes they have like cervical fractures too. Shoulder on the shoulders as well.
Okay.
Yeah,
Okay.
basically.
Yeah. So you do get a little bit of a variety, but hip seems to be the
Yes.
specialty, the
Yeah.
flavor of
Yes.
the unit.
Yeah.
Yeah.
Yes.
So you get
Yeah.
really good with hips. What happens when a shoulder comes in? Do you get a little panicky, like I don't know what to do with the shoulder?
Well, when they come to the unit, they have this sling on. So I think, yeah, we just have to, like, do pain management and some assessments as
Yeah.
well, CSMTs and stuff.
Yeah. I know you guys fully, the patients are there 24/7. They don't go home. They don't get passes. They stay on the unit the entire time.
Some of them, they can get day passes, but it depends on the doctor. If the
Mhm.
doctor feels like this patient can, go for a day pass or
Yeah.
something. But most of the time, they're just there. Yeah.
Okay. So walk us through like a typical day. How many patients would you have?
For me, one LPN is to 15 patients.
Well, that's a heavy load. Well, it sounds heavy. Like we think of numbers, we think of heavy.
Yes. But the good thing about it is that we have how many healthcare aides? We have, I think, 4 or 5 healthcare aides. So basically, they're assigned to do the care for the
Hmm.
patients. For us, it's the meds, um, wound care, doing your vascular assessments. Yes.
Okay. So there is a nice team. There's a good team size
Yes.
there to take care of all these patients and
Yeah.
address their needs.
Which is pretty good. Yes.
Okay. Well, that's really helpful. I think for those listening, it's kind of starting to break down the roles of an LPN on an orthopedic rehab unit.
Yes. Yes.
Okay. So you're focusing on medications in the morning, kind of a timeline, your assessments and medications, and then you take care of any wounds. Do you
Yes. Yeah.
participate in the mobility and the movement of the patients as well?
Sometimes we help out walking our patients, but we have a rehab team as well, consists of physiotherapists, occupational therapists, therapy assistants, wherein they're really the ones who are assigned to do those kinds of things for the patients. And then we just help sometimes walking with them, or if the patient is two-person assist, then we help some of them to do it for the
Hmm.
patient. Yes.
Hmm. Oh, that's awesome. So you've been there
Yes.
a couple of years now. You've probably got a few tips and tricks that you've learned along the way
Yes.
that you can help share with those who maybe are looking at a job in orthopedic rehab.
Yeah, true. Yeah, I have some or a lot.
You want to share a couple?
Yeah, sure. In an orthopedic rehab unit, we are also taking care of IV meds, which is I'm really happy about it because I got to practice my skill that I learned from school. So okay, here are the things. If you're going to a rehab unit or if you want to land a job in an orthopedic rehab unit, you need to come prepared, like especially for the interview, or search about the unit, search in Google about what is the unit all about, what is the company all about, what do they do there, what are their programs there, so that you'll be having this knowledge or information. Oh, this is the things that I have to learn, that I have to search about before going in there. And then secondly, in the rehab unit, you have to uh, s- stay stay positive, keep smiling, because you're, for example, like me, I was brand new, but then I'm the person who always want to smile. So it gives, like, that rapport that you want to learn. You can ask questions to them and stuff. Thirdly, in the rehab unit, not all of the patients are kind. Not all of the patients are nice. So you need to stay professional all the time. Whenever they say something to even your coworkers, in everything that you do, you have to stay professional. Even though some of those things that you feel like it's um, contradicting on your belief, or you feel like it's wrong, or you feel like it's a bit off, but you have to stay professional and still pay respect to everyone, pay respect to your patients, pay respect to your bosses and your coworkers, because if there's respect, then it's the start of a teamwork. Although there are things that some of your coworkers are not agreeing on, but if there's respect, if there's communication, it's really important as well. Then you'll be able to finish the task properly, will be able to help the patients properly. And I think lastly, always be kind. in everything. Always be kind in what you do, and just think about nursing not only a profession, not only a source of like making good money, but it's a passion. That no matter how hard it is on the entire shift that you've been through, no matter how physically, mentally, emotionally tiring it is, then if your mindset is that nursing is a passion, then everything, every tiredness, every stress will be taken away.
That sounds like a lovely slogan. Always be kind and wear your best smile.
Yes.
That's lovely.
Yeah.
Well, thank you for sharing that stuff. I think it's important for those who are looking at a career in
Yeah.
orthopedic rehabilitation. Maybe this is by choice or by design. You don't know what you're going to get when you first come out there. Or
True.
they just have a real passion to help with the geriatric population, is knowing that the energy that you bring to that relationship goes a long way in towards creating that really collaborative and therapeutic relationship, especially with the population where, you know, that dementia and they have some other psychological, maybe their medications are making them feel a little bit less than normal, just to
Yeah.
help bridge that gap.
Yes. Yeah. Because for the skills, like for example in my unit there are lots of skills. On for the skills you can easily learn that, like if you go for education, if you go for like um this 2 day seminar, or in the I mean in the unit, when you go for your body shifts you can easily learn that. But then, you know, behind those skills that you can do, the most important is your character as a nurse, that you're willing to learn, that you're willing to listen, and you're willing to help people. Yeah.
Mm-hmm. You had mentioned that sometimes they'll say things or do things that don't feel quite right. Is there a moment that comes to mind that you can share where you felt like you were in one of those situations and you were still able to put your professional voice forward, but just kind of like talk about how that may have stung or how you dealt with that?
Yeah, most of the time when, you know, because you're a new nurse, then you're saying that you know what you're doing. You hear that from your patients or sometimes from your coworkers because you're new. They're like, maybe they really want to test like your capability on doing certain stuff. So sometimes they're saying that you feel like sometimes um you've been hurt because they're questioning your capability as a professional. But then I realized that that's a stepping stone to, you know, step up, and then how you communicate, how you deal with that things to, although they say those things, but in return your response should still be professional. That if it's like, you know, outside, then some maybe you're gonna get mad, or you're gonna get hurt, or you're gonna say things that, you know, that would be hurting them back. But because it's a profession and you have to stay professional with those people saying those things, then you have to stay calm. You have to stay that okay, I'm a graduate, I learned this stuff and I know how to do it. And then by saying that nicely to them, then, you know, it would still create a good relationship.
Mm-hmm. And then how do you deal with that? Like, do you leave it after you leave the room? Is it all gone? You've shown them that you're capable, the skill's done. You're like, okay, this is
Yes.
good. Yeah, you don't carry it home with you?
No, I don't. So once that those words came into one side of my ear, I put it outside of my other ear. I don't want to contain it in my mind because that would make me, you know, that would make me sad, or like a bit, you know, there will be questions about myself, but
Yeah.
I don't want to do that. Yeah.
That's, you know, that's an important piece. You're really role modeling that choice factor in what you
Yes.
let resonate inside of you and what you let go and how you show up every day.
Yes. Yeah.
That's
It's
beautiful.
important.
So
Yeah.
speaking of showing up every day, my singing friend, the singing nurse, aka singing nurse Angelo.
Yes.
Now you are a professional singer. Why don't we talk a little
Yes,
bit
I
about
am.
that and let the audience know a little bit about your personal life?
Okay, so professional singing. Back home I'd like to do it, but then I'm always singing at the church. It's my first love, like it's the talent that God gave to us. So for me, I'd like to give it back to God, like giving my talent stuff. So I'm singing at the church, but I don't sing professionally back home. Like I don't get paid. I don't sing in events and stuff. But then when I came back here after I did my nursing program, I realized that okay, I'm done pursuing nursing. So I think it's time to pursue singing after my schooling. And then 2 years ago, my coworker has a a friend who is a producer of events here in Edmonton. So, and he is also the coordinator for the World Championship of Performing Arts in California for Team Canada. So I met with him, and then he offered me to do a mini concert, a back-to-back concert. So I'm really ecstatic about it. I was really excited about it. And then that happened. Like I started to do some open acts from certain bands, like in the Filipino community. And then fast forward February of 2019, I was able to do my very first back-to-back concert wherein my families are there, my coworkers are there, my friends are there. There's like 150 people in total. So which is really awesome. Plus the bonus there is that I get paid.
That's even
that's my very
better.
first that's my very first paycheck that I received from singing. And then from that moment on, I started to do front acts for Filipino artists that comes here in Edmonton, and then perform in some Filipino events. Like the last time was in June of 2019. It's Edmonton Filipino Fiesta, when um, not only from the Filipino community, everyone is invited, and I'm really glad that everyone is there. Not only Filipinos, but then different people from all over the
Mhm.
world. They're there, and then I started to do host events as well. I'm an events host as well, and then on top of that, then professional singing, like combined.
That's amazing. Congratulations.
Yes.
Listen, I know how hard it is to get into the business and the work you have to
Yeah.
do and the grind, because as I shared with you earlier, I used to sing back in my 20s when I wasn't a geriatric. um, and back then I thought I was going to be like a country star, and that's all I had my vision on, but I was too shy
Yeah.
I lacked the confidence to move to the place I needed to be, which was Nashville. And so I
Mm.
always joked around that when I got older, I would do the geriatric circuit, which is something you're doing now in
Oh.
your job. You're singing to your
Yeah.
residents.
Yeah, you know what? That's really awesome. Like back, I think just to add it up, back in Christmas time, some of our patients doesn't have visitors, so I was working evening shift that time. So during their supper, I brought my speaker, my portable speaker, and then I sang Christmas songs to them. So they were
Aww.
very happy about it. I was really happy as well that not only nursing that I was able to do, but my singing part, my singing profession as well, or my singing passion as well, that I was able to share that talent to everyone, to our residents, to our patients, and to
Mm-hmm.
my friends and coworkers as well. Yeah.
Yeah, that's awesome. Do you know
It
Paul
is.
Brandt? Have you heard of Paul Brandt?
No,
He's a country
no.
singer who was a nurse. He used to
Oh,
sing to his
really?
patients all the time.
Oh, wow. Yeah. So I'm gonna search about him right after this.
Yeah, and you're going to search me too, you said. No,
Yeah.
I'm kidding.
Yeah, true. Yeah. The two of you.
That's awesome. So, do you have a favorite song you like to sing?
Mm. Give me a sec. I'd like to sing "Thinking Out Loud" by Ed Sheeran, one of my favorites.
Oh, okay.
Yeah.
Give us a little sample. I'll
Yeah.
put you
Give
on
me
the
a sec.
spot here. All right.
Yeah. Give me a second.
If I find a place where I can jump in, I will jump in with you, but I probably don't know the lyrics very well.
But what song do you like to do? Maybe I know that.
I do a lot of bluegrass kind of stuff. I'm more
Uh
of a
huh.
country soul, so
I'm more of country song. Or maybe it's like pop, and then yeah, it jumps
yeah,
from one genre to another. Okay.
that's all good. You start, and if I can pop in, I will.
Okay, no problem. When your legs don't work like they used to before, and I can't sweep you off of your feet, will your mouth still remember the taste of my love? Yeah. Will your eyes still smile from your cheeks? Darling, I will be loving you till we're 17. And baby, my heart could still feel less hard at 23. I'm thinking about how people fall in love in mysterious ways. Maybe it's a part of a plan. And I just keep on making the same mistakes, hoping that you'll understand. Baby, now take me into your loving arms. Kiss me under the light of 1,000 stars. Take your hand on my beating heart. I'm thinking out loud. Maybe we found
love right where we
where we are. There you go.
I do know the song, but I couldn't think of the words. I'm like, oh, I want to jump in, but I couldn't think of the words. That was beautiful.
Yeah.
You have come a long
Thank
way
you so
because
much.
I have
And
watched some of your videos when you first started. And I think your
yeah,
voice has come
yeah.
a super long way. It's amazing.
It's a long way, and then yeah, I'm continuing to practice and stuff. Yeah.
Well done. Well, thank you so much for joining me today on the Frontline Nursing
Yeah.
podcast and for sharing your talents, both
Yeah.
nursing stories and your musical talents.
Thank you as well for this opportunity, Tammy. It's really good. It's really
It has
great. I'm
been
really
great.
happy.
Thank you so
Yeah.
much. Now, the fun hasn't stopped just because this interview is over. Join us at the membership site, frontlinenursingpodcast.com, where you will get the video footage of this interview and our after the recording. In addition, our guests create a download specifically designed for you. Now, if you'd like to be featured here, email me at info@tammydunnett.com and we'll get your story online.